our first reaction is always banning travel, restricting travel, and locking down again. For example, my son started school just 2 weeks ago and it's shut again from next Monday. So my happiness is just evaporated. He cannot go back to school. Should that be the first reaction to this variant also?
No, so that's why I'm saying that detection of individual cases should not necessarily lead to shutting down an educational facility. What do you want to prevent in a school, right? You want to prevent children from getting really ill because children have not been vaccinated. You don't want children carrying infections home where there might be vulnerable people. So what I'm saying is if you detect one case in a school, let's say, then I would suggest that you test all the children around that child or adult or whoever their contacts are. If you find that transmission has happened already, that group, the whole group, not just the ones that test positive, should be restricted from school so that you don't have ongoing transmission, right? If you find an isolated case that has not transmitted to anybody else, I would just tell the case, go home and come back once you've tested negative, right? So what you need is to evolve strategies that are sensible, that don't shut entire schools down because one case was detected. If clusters are detected, that's a different story.
But ma'am, though this sounds sensible and non-alarming, the point is that people are again alarmed, and whether it's schools or offices, there is a concern that what if there are asymptomatic cases? For example, you are saying if one case is detected, that means it's someone symptomatic and you test them. But what if there is somebody in a school or an office space who's asymptomatic and then spreads the variant or the disease itself to others unknown? That's a fear, right? Which most people have, which is leading to shutdown again, a lockdown again.
And how will you prevent it with a shutdown? Right? It's an asymptomatic infection. Do you stop school forever? Because that's the only way of being safe. That I didn't have transmission in school because no child ever came to school. Right? You are not going to be able to stop asymptomatic transmission forever. The only way to do that is to stop people ever coming in contact with each other. That's not sensible. And we have to remember that if we look at risk profiles, healthy children are best able to handle the virus. So we should make sure that children with comorbidities are protected, that all adults are vaccinated. I'm not advocating for letting a virus into school and letting it run wild. That's why I'm saying if you detect a cluster, you want to slow spread down. So you isolate whoever is in or in contact with that cluster. But it's not that you shut the entire school down because there is one cluster that may not have anything to do with other classes in the school or other groups in the school.
I'm going to let you go with just one or two more questions because I know that you must be getting approached for a lot of reactions. My question in continuation with what we were speaking is that, so what do you think should government strategy be? Should we look beyond travel bans, travel restrictions and lockdowns? Because that's all the conversation is even now.
I think lockdowns were fine when you did not have the tools that we had in the very, very early days when the aim was to flatten the curve, right? Now we are not talking about flattening the curve anymore. We have vaccines, we have drugs. We can do something if people get infected. We can do something to protect the bulk of our population from getting really sick. So we need to plan our current strategy based on the tools we have today and not the reactions that we had last year. So therefore, lockdowns make no sense. Travel bans make no sense. Testing for travel, before travel, after travel, sure, that makes sense. What are you going to achieve with that? You're going to slow the entry of new variants into your country, and you will again have time to learn more about the variant and learn how to handle it. Okay, so use the tools you have. Develop strategies that are predictable so people know if a new variant emerges, this is what the government strategy is going to be. Not that one city does one thing, one state does another thing, one country does one thing, and another country does another thing. This makes no sense at all. People cannot function without predictability in what will happen. The virus itself is unpredictable enough. We don't need policy unpredictability as well.